welcome back to my channel. Today we are going to do the revision of the respiratory system and its changes which occurs during the pregnancy. So before starting this, we have to understand this graph. This graph is very important because it explains the whole system of the respiratory system. So starting with the tidal volume. So what is tidal volume? Tidal volume is the air in the lung in the silent respiration, such that there is normal inspiration and there is the normal expiration. And then what is inspiratory reserve volume? Inspiratory reserve volume, it is the maximum air which can be inspired. And what is expiratory reserve volume? It is the maximum air that can be expired. And after that there is a residual volume, and residual volume, it is the air that is left in the lung after maximum expiration. Now the next important thing is the functional capacity. The functional capacity, it is equal to the residual volume and expiratory reserve volume. It is a summation of residual volume and expiratory reserve volume. It is the air after the normal expiration which is left in the lungs. Now next is the inspiratory capacity, and it is the maximum air that can be inspired, and it is inspiratory reserve volume and tidal volume. Expiratory reserve volume and tidal volume. Now next is the vital capacity. It is the inspiratory reserve volume, it is the tidal volume, and it is the expiratory reserve volume. It is the maximum air that can be expired after the maximum inspiratory efforts. And at the last, there is a total lung capacity. The total lung capacity is the tidal volume, it is the inspiratory reserve volume, it is the expiratory reserve volume, and it is the residual capacity, such that it is the maximum amount of the air which can a lung hold. Now let's move on next point, and here are the certain things which does not change during the pregnancy, and these are the vital capacity, the peak expiratory flow rate, and the lung compliance, it remains the same. Now what things they do decreases or increases? First let's see the what things which reduces in the pregnancy. There is a reduction of there is a 20% decrease in the functional residual volume, and there is a decrease in the total lung capacity for 5%, and there is decrease of the expiratory reserve volume and inspiratory reserve volume, it decreases to 20%, and there is a decrease in the carbon dioxide which is 30%, and there is decrease in the airway resistance. So what things they increase is in the pregnancy, there is a tidal volume which increases by 30 to 50%, respiratory rate it also increases, and there is increase in a minute ventilation due to stimulation of the respiratory centers by the progesterone, and there is increased consumption by consumption of the oxygen, which increases by 50 ml per minute, and there is increased pressure of the oxygen which is around 14 kilopascals, and hence there is increased risk of the pulmonary edema. Now the most important graph here, it is the oxygen dissociation curve, and R is for right and R is for the reduced affinity of for the oxygen, and such that when the curve it moves towards the right, there will be decreased affinity for the oxygen, and this occurs due to increase in the partial or pressure of the carbon dioxide, which is because of the hypercapnia, and when there are the increased hydrogen ions which lead to the increased acidity and decreased pH, and when there is increase to 3 dBg, and when temperature increases, they lead to the decreased affinity for the oxygen. Left shift is for the increased affinity for the oxygen, and it is due to the carbon monoxide, the fetal hemoglobin alkalosis, and decrease PCO2, and decrease hydrogen ions, and decrease in the 2-3 dBg, and decrease in the temperature. So this concludes our revision notes, high yield points for the respiratory system. Stay tuned, I'm going to upload next video in a few days. Thank you.